Well, medications are the leading cause of child poisoning. According to Children's Hospital, more than 60,000 children go to the ER every year for accidental medication poisoning. Many of these accidents happen when a child is visiting a relative's home, as many of us will be doing over the holidays. And we talked with Dr. Julia Arana from Children's Hospital about tips to keep children safe.
Very common in children, and especially when they're in different situations, like travel, visiting family, and things like that. So it's always important to be aware, but especially this time of year. Well, children put everything in their mouth, so they'll put anything they can get their hands on. So it's important to keep things out of places that they are. So a nightstand, grandma's purse or mom's purse. When you go visit, they may have a pill counter on the counter, and just think nothing of it because they're not thinking the child would want to take that. And then we also drop medications on the floor, and children are on the floor. So they just walk around, see something. I mean, it could be dirt, it could be a pill, it could be anything, and they're going to put that in their mouth. Usually, no one witnesses the event, so it is important to be aware of those signs and symptoms. So, a sudden change in behavior. They can be sleepy, but they can also be agitated. They seem confused. You sometimes can smell an odd odor around their mouth or even on their clothing because they can ingest other things. Pill fragments can sometimes be seen in the mouth. If they're drooling, kind of staring off into space, unusual eye pupils that look kind of different, or they're vomiting, those are typical signs. If you notice that your child has or think your child could have ingested something, first you need to assess if they're stable. Are they breathing? Are they, really altered, things like that? You would want to call 911 if you felt your child was very, very changed. If you see something that maybe not, that kind of thing, you can always call Poison Control Center. It's important to have that number available, 1-800-222-1222. We always recommend that families go ahead and program that into your phone, give it to your babysitter and the family members that may be taking care of your child, so that they're ready for that.